And we have a climate and human health research unit at KEMRI in Kisumu. Um, so most of what I'm about to say has just been covered in by the previous speaker, but we are now going to focus more into the future, what is going on. Now, the major driver of this is climate change. So we want to see what climate change is doing and what it's going to do in the near future. So the observations that have been made recently is a high rate of increase in the mean temperatures, particularly in May to June. That's the main rain season, and that's the main transmission season for these vector-borne and waterborne diseases. Now, all those diseases, or rather the vectors and the pathogens, are climate sensitive and particularly temperature sensitive. So the higher the temperatures, particularly during that period, the higher the rate of transmission. Now, we also observed a high trend in the maximum and minimum temperatures. I monitored temperatures in around Kisumu, and in the last few months, we've seen quite a dramatic increase in the minimum temperatures at night. Whereas they used to be around 1918, now we are seeing about 22, 23. It only gets to 1918 early in the morning, around 5 or 6. For the rest of the night, we're in the 20s. That's very unusual. So that will support the vectors. Now, we have seen an increase in extreme temperatures. Before, the extreme temperatures around this area used to be about 33, 34. But once in a while, we have seen 36, 37, and studies have shown that this is a general trend in the region. We have seen no clear change in the rainfall trends. Some places may have had extreme rains, but generally the totals don't seem to have a particular trend. There are some observations that during the long rains, there's a decrease in the total rainfall, and the shorter rains are receiving heavier rainfall. But on average, the trend is not very clear. There's then increase in a frequency of extreme events, such as flooding. Of course, flooding, if it's in some cases, will drive vector-borne diseases and also water and foodborne diseases. Okay. Now, the diseases we're concerned with are basically the vector-borne diseases, such as malaria, which is a very big one. Rift Valley fever, it's another big one, and is expanding its range. Dengue is becoming more common, and it's terrible because sometimes it's misdiagnosed as malaria. We have seen some outbreaks of chikungunya, and these diseases are driven by temperatures. The mosquitoes take a much shorter time to develop during high temperatures. They also affect the virus in a mosquito. And this effect is actually exponential. A very minor change in external temperature can significantly reduce the time it takes the virus to develop in a mosquito. So that intensifies transmission. The same thing with the parasites, such as malaria parasites. The hotter it is, the shorter they take to develop in mosquitoes. And therefore, each mosquitoes can transmit to many more people. Then we have the waterborne diseases, the big one being cholera, of course. It was in the 80s, maybe even 70s, it was confined to the Lake Victoria region. We did some work in the early 20s monitoring cholera around the lake and in the adjacent highlands, the Western Kenya highlands. And we didn't find any cases of cholera in the highlands. But now, recent reports indicate that the cholera has moved up the highlands. And more interesting, it's moved up to central Kenya, where cholera was basically an unknown. Now, it's not very clear whether this is because of just human movement or the conditions have changed to the extent that now they support cholera. This one is a bit complicated, but it is the disease is definitely shifting around. Then we have Shigella, a terrible disease. This is a diarrheal disease. E. coli, those are waterborne diseases. Amoebiasis, Giardia, and another one which became notable during the HIV outbreaks, Cryptosporidium. It's a waterborne disease, and it causes serious disease to people who are immunocompromised. So with HIV, we saw a lot of cryptosporidium, but it's a waterborne disease, so it's fecal disease, and it will get into public water supplies because of flooding. So, as we said, there are increasing flooding, so that's a threat. So, the threats from climate change involve continued increase in temperatures. Of course, those who support all these vector-borne diseases. It will also support some diseases like meningitis, which are airborne diseases, asthma, common colds because of pollen. Then we have an increase in it also causes what we now call isotherm shift. In other words, it gets warmer in the highlands, as would be noticed in Kenya, Ethiopia, Burundi, Tanzania. So the highlands become better, warmer, and therefore the mosquitoes will establish themselves and the diseases will shift upwards. So that one is observed. There's an increase in extreme precipitation. In Kenya, people will know about Pokot, terrible floods in a lake shore area. The lake has gone up by 1 meter, and the lake shores are being flooded. So although there seems to be no trend in the total rainfall, things such as the recent increase in the lake level, and not just Lake Victoria, you have Nakuru, Bogoria, and other possibly Turkana, that's an indication that something is going on. So this trend will support disease transmission. Now, intervention related threats. You will know that the whole region has a common intervention for malaria. They have mass distribution of insecticide-treated bed nets. Now, when these insecticide-treated nets were issued, they were very effective because mosquitoes were completely susceptible to the insecticide. But in recent years, we have carried out studies in Western Kenya and elsewhere, this East Africa generally, and the mosquitoes have become resistant to pyrethroids. and they're not that effective now. The other thing that's going on is that the mosquitoes, these things are very smart. Never underrate these mosquitoes. They're changing their behavior because people sleep after 9 o'clock, and it's too dangerous to bite after 9. They are now biting, not all of them, but some of them, and an increasing number is biting before 9. In places like Ethiopia, you have several vectors that are biting people outside. For instance, these are mosquito species, and they are now vectors. They don't go inside the houses, but they wait for people before they go inside the houses. They bite and transmit. So the other issue apart from mosquitoes is that we know, like in the 80s, actually from late 70s, the malaria parasites became resistant to chloroquine and another drug called sulfadoxine pyrimethamine, SP. Fortunately, in the early 2000s, we got the artemisinin combination therapy, which was developed from a Chinese drug. It's still very good, but in some parts of Southeast Asia, there is some evidence of resistance, and that can be expected to spread into a region. So that's another threat. So the interventions may fail while the transmission is increasing, or the transmission conditions are getting better. So that's really a very serious problem. Now, we don't have vaccines yet. Not good enough. They are there, but they have an efficacy of about 40%. And you need several doses, I think 3 to 4 doses to get it. And only 40% of the people will be protected. They're working on this. Hopefully, the efficacy will improve and more people will be protected. Now, we don't have, now you can see there is a spelling mistake in that sentence. I don't know what it means. We don't have, we have vaccines for very few, but for cattle, for livestock. That vaccine has not been approved for human use. We don't have an effective vaccine for dengue, and dengue is increasing. Now, chikungunya virus is worrisome because it seems to be mutating. Before it was transmitted by local mosquitoes, Anopheles gambiae, Anopheles finestus. But we then got an Asian mosquito called an Asian tiger mosquito, Anopheles albopictus. When that virus entered this vector, it seems to have become more virulent. So that's worrisome because chikungunya wasn't that serious. You got your pains, you had a fever, but now it can make you very sick. So that's something to worry about, and it's spreading quite fast. So what we do, we need to undertake very active surveillance of vectors, check the resistance, check the virus, see if they are becoming more virulent. For instance, dengue has 4 viruses, type 1, type 2, type 3, type 4. If you get type 1, you get away with it. If you get more than one, the disease becomes what is called hemorrhagic. You bleed everywhere, and that kills. So the more isotypes we have, the more dangerous it is. So we have to keep monitoring and trying to find out how many strains we have. Of course, we have to keep on looking at how sensitive the malaria parasites are to current medication. So then we need, now this is where we are saying, we don't mean non-smoking. It is active monitoring of the efficacy of these therapies. Now we need to develop sustainable adaptation. That is, we are getting to the conclusion of this. We should not just wait and watch. We are arguing that our current institutions will become highly vulnerable. We saw this in 1997, 98, when we have multiple and complex disasters. We had Rift Valley fever, we had cholera, we had malaria. Those are the big ones, the super diseases. But you also had the little ones in the background. One country actually ran out of medicines in the South African region. They didn't have enough medicines to treat malaria, so people just died. There are others, you have drugs, but they're not very effective. So we need to have a very, very active system to monitor. And another thing is to be able to focus these disease extremes. We in Kemri have developed a system for focusing malaria epidemics in the Western Kenya Highlands. There's need to develop such models of early warning systems for cholera so that we are prepared, we are not caught unaware. So it's up to our governments to support research in this area of adaptation.